Hello from Chimeda Aesthetics. Today we're going to present BioReTherapy. It's a revitalizing, antioxidant, moisturizing treatment specifically for the face and body. We're going to present 4 products today: BioRePeel FND face, neck and décolleté, BioRePeel body for all the parts of the body, BioRelift and BioRehydra. It's a biphasic patented technology. We have the pending patent all over the world, so there's no such other product which you're going to be able to find anywhere else. Why is it important? Why is biphasic technology so important? Monophasic TCA, which was very well known for all those years, would have to be preserved in the fridge, would oxidize or denaturalized, would be unstable and darkening. Patented technology allowed to achieve the room temperature stability. It allowed to achieve no TCA oxidization, no formulation darkening or degradation of the active ingredients, and functionalized lipolytic phase. So the lipolytic phase, you will see 2 different phases in the product. Lipolytic phase is the phase which is on top of the product, the darker green phase. It prevents trichloric acid oxidization, it prevents denaturalization, it stabilizes all the active ingredients inside the product. It has also firming and vinculating action, which means it will help to carry out all the active ingredients much deeper inside the skin. It will help for active professional treatment. It has regenerating properties and moisturizing properties, which is very important when we're performing any professional treatment in the salon. And of course, biostimulating action is you're going to find in hydrolipid phase. It is biostimulating action, revitalizing action, keratolytic and peeling action, which means it will remove the cells from the stratum corneum. It will allow for the penetration of the active ingredients and for the revitalization of the skin. Of course, it's going to work for acne problems, it's going to work for all the different skin problems. It will allow for regeneration, redermalization of the skin, and tackling all the different skin conditions. So the biphasic technology overview: lipolytic phase, which floats on the top of hydrophilic phase, which will provide from the denaturalization of the product, from oxidization of the TCA. It will stabilize the product, it will prevent from denaturalization, it will provide mechanical barrier for the product. So the main features of the BioRePeel CL-free: no needles, you do not require any needles, you do not require injections when you're performing BioRePeel therapy. It is painless treatment. Of course, your patient might feel a little bit of tingling. We are dealing with the TCA acid, we are dealing with active ingredients. Well, they penetrate, they might create a little bit of tingling effect, but this effect will last for just a couple of seconds and then will subside. It is a very fast treatment. It will take roughly 15 to 20 minutes to perform all the basic procedure. It is multifunctional, which means you are able to combine it with other treatments in your salon. It will give you immediate effect, so the patient leaving the salon will already see the difference, will already see the benefits of the therapy. There's no post-treatment signs, which means there's no recovery time. There's no recovery time for the patient. There's no requirement for your patients to stay at home for a certain period of time. They are ready to come back to the daily routine straight away after the treatment. This is the treatment for the whole body, for all ages. You of course need to check with your requirements from which age you are able to treat your patients, but it is product suitable for all ages and for all skin types, which means you can treat your patients all Fitzpatrick type, from type 1 to type 6. There's no exclusions if it comes to Fitzpatrick types. And for every season, which means you are able to perform this therapy during the sunny time, during the summer, during the winter, during the autumn, so there's no exclusions regarding the seasons. This product is not photosensitizing. Of course, you need to pay attention to what other procedures you're combining BioRePeel therapy with, but BioRePeel itself, BioRePeel therapy, it's not photosensitizing, which means you are not excluding from your daily activities. You do not need to worry about TCA in stabilized form causing any action which would cause pigmentation, which would cause any unwanted effects. There is 4 functional complexes: biologically active substances, glycine, proline, hydroxyproline, and vitamin C, revitalizing action, GABA, arginine, and riboflavin. Of course, peeling action, which is going to be our main active ingredients: TCA, lactobionic acid, salicylic acid, tartaric and citric acid, and lipolytic phase, so the squalane and isopropyl mystrate. As you know, amino acids are building blocks of every single cell. They are the most important active ingredients which will help to revitalize the skin. So the glycine, 35% of the collagen just of this one amino acid. Proline, a basic amino acid, taking part in collagen synthesis. It's indicated for inelastic skins. It's indicated for the skins with the signs of aging, which need revitalization. Hydroxyproline, also widely present in the collagen. It supports a proliferation process, also proliferation of the fibroblast, activity of the fibroblast. And vitamin C, it's essential cofactor in collagen synthesis. It will help to promote the collagen proliferation. It is stabilized form of vitamin C, which means it will not oxidize when we applying the product on the skin. It's going to be able to penetrate the skin and support all the revitalization. GABA, this is the amino acid which is going to help you to see those immediate results straight away after the treatment. You will see those results especially around the eye area, especially around the perioral area. You will see immediate improvement in the lines and wrinkles, so flattening on the little lines and wrinkles. It is also very important because it has anti-wrinkle action. It will relax the skin, but it's very important because it's also helping with reduction of metalloproteinase synthesis. Arginine. Arginine for us is very important because it's going to help us to treat all those skins with such conditions as rosacea. We're going to be very helpful when you're treating stretch marks, when you're treating scarring. It helps with angiogenesis, which is creation of the new capillaries, new vessels. So that's why we have this product with indication as well for those skins with rosacea, with open capillaries, with the skins which needs treatment for the lines and wrinkles, but also stretch marks and scars. Vitamin B2, it's the precursor of the metabolism of other vitamins. It's going to be indication for the skins which have too much of the production of the sebum. So it will regulate the sebum production. It will help with the oily skins, with the skins which are prone to production of the too much sebum. So as you can see, the product is already indicated for so many different skin types and skin conditions. And moving on to the peeling action, the TCA. TCA has been known for years, has been used for years in aesthetic medicine. The problem with TCA was the long time recovery. So the patient had to recover for 2 to 3 weeks. The sun had to be avoided. But the main action of the TCA, it's not the one of the peeling as we think. The main action of TCA is going to be promotion of all the biocascade of the regenerative processes. It's activation of the growth factors, vascular growth factor, palate-derived growth factor, TGF alpha and beta growth factors. So we have very powerful ingredients which will help us to remodelize the skin, revitalize the skin. They're very powerful ingredient which works on different depths of the skin. So we're going to be able to tackle pigmentation, we're going to be able to tackle wrinkles, we're going to be able to tackle all the different skin conditions and help to reverse the time. Lactobionic acid, a very powerful moisturizing molecule. It will moisturize the skin, it will help to hydrate the skin. It reduces metalloproteinase, which is enzymes which we very much need in the skin, but when it's overproduction of metalloproteinase, it starts degrading our own protein, it starts damaging our protein. So reducing the activity of metalloproteinase will help us to slow down the aging, will help us to redermalize the skin. Salicylic acid has been used also for a very long time in aesthetic medicine. It's been used mostly for the treatment of acne. It's been used mostly for the treatment for oily skin, for the open pores. It has bacteriostatic action, keratolytic action. It reduces the possibility formation of acne lesions, of pustules, papules. Tartaric and citric acid, they're not usually used on their own, but as an addition to the product, they have very important action. A very powerful antioxidant molecule, lightening, exfoliating, keratolytic action. If we look at citric acid, very important as it's going to bind the calcium ions, it's going to bind them together, and pulling them together, it's going to allow for much deeper penetration of the active ingredients to the deeper layers of the skin. So let's look at two different products which we're presenting today. BioRePeel FND face, neck and décolleté. So we're treating face, neck, décolleté and intimate area with this product, BioRePeel FND. It contains TCA acid 35%, lactobionic acid, salicylic, tartaric and citric acid, glycine, proline, hydroxyproline, GABA, which are very important amino acids. Of course, vitamin C, which I mentioned, is going to be playing important role in collagen proliferation and collagen production. Squalane and isopropyl mystrate, which will have feculating action and moisturizing action, but also protective action for the active ingredients in the product. So the basic treatment protocol, this is the product which we apply topically on the skin. The basic treatment protocol, it's going to be performed every 7 to 10 days. Recommended amount of session is 4 to 6 sessions once a week. So once a week, 7 to 10 days, 4 to 6 protocols. The second product from the BioRePeel range, it's going to be BioRePeel Body. BioRePeel Body is used for the whole body, as I said, except for intimate area. But for the whole body, it contains 50% of the TCA, also contains salicylic acid, citric acid, tartaric acid, amino acids, vitamin C, squalane and isopropyl mystrate. To carry on the treatment, you're going to carry one treatment every 10 to 15 days, applying the product topically for 10 minutes, massaging into the skin. So after you massage the product to the skin, you are leaving it for 10 minutes and then removing with water. We recommend 4 to 6 treatment every 10 to 15 days. So application. This is very advanced product, but with easy application. What it means? It means you are not going to spend a lot of time preparing the product. The product is already prepared for you. All you need to do, you need to shake the ampoule very well. You are just taking the metal lid from the top of the product. Please release the pressure from the product before you start drawing the product. So shake the product really well. Then you take 18G needle, you release all the accumulation of the gas, all the accumulation of the pressure from the bottle, and then you're drawing, using the syringe, you're drawing 2 milliliters of the product for the face. How you can remember how much product to take? If you look at the palm, this is going to be 1 milliliter. So comparing to the face, you're going to have 2 milliliters on the face, and then you can just measure décolleté, neck or body area. So palm size, it's going to be 1 milliliter. So you're taking 2 milliliters per treatment of the facial area. You are applying the product, you are massaging the product onto the treatment area. You're leaving it for the amount of time which is recommended. So for the face, it's going to be 3 to 5 minutes. For the body, it's going to be 10 minutes. After the recommended application time, you are removing the product with water. The product do not require neutralization. TCA is self-neutralizing acid. So I mentioned before about association, about combination with other treatments which you are offering in your clinics. So you can do it before any injectable treatment. You can do BioRePeel before injectable treatment, before photostimulation, after radiofrequency, and before any other topical treatments which you will perform in your clinic. In order to prolong the effects of the BioRePeel therapy and avoid any possible complications, we have created post-treatment care, which is used immediately after the treatment of the BioRePeel in the salon, but also as the home care. It contains of 2 different products, BioRelift and BioRehydra. BioRehydra serum, it's a serum in a gel form which is fast absorbing, which is being used immediately after the BioRePeel therapy and also after different invasive treatments in the salon, but also as a serum which your patients are going to use at home in order to prolong the effects of the therapy which you performed in the salon. BioReHydra contains over 15 active ingredients such as micronized hyaluronic acid, different ocean extract, algae extract full of flavonoids which are anti-aging, which have very strong moisturizing and regenerating action for the skin, micronized hyaluronic acid. This form of hyaluronic acid allows for the penetration in the skin without compromising the skin barrier, vitamins, GABA, but also amino acids which are basic building blocks of every single cell. BioRelief is a very rich post-treatment cream which will help your patients, will help you to rebuild the skin barrier which is necessary after use of every single therapy, invasive therapy in the salon, especially BioRePeel. It's a very rich texture but also very fast absorbing. It contains over 20 active ingredients such as micronized hyaluronic acid, 4 biomimetic peptides, argan and almond oil, which will help to rebuild the skin barrier, which will moisturize and protect the skin, colloidal platinum, shea butter, vitamins, bisabol and amino acids. Those 2 products can be used on the whole body all year round, both morning and evening. BioRelief and BioReHydra come in 2 different sizes for 2 different needs. So the first size is going to be 200 milliliter size, which is used in the studio, which is used in the clinic for the doctors to offer post-treatment product, which is going to allow to avoid any complications, which is going to prolong the effects of the BioRePeel therapy. It's going to be used immediately after the BioRePeel treatment. It can be used immediately after radiofrequency treatment, also post-laser treatment. 30 milliliters is the home size, so the size which your patients are going to be used at home. It's going to be used between the treatments of the BioRePeel to ensure avoidance of any possible complication, but also providing better effects of the BioRePeel therapy. It's going to be used in the morning and in the evening, and this is going to be the only home care which you're going to offer to your patients. How to use it at home? For the dry skin, we offer BioRelief in the morning and in the evening. For the normal or combination skin, we offer BioReHydra in the morning and BioRelief in the evening. And for the oily skin, our option is to offer BioReHydra as the morning treatment, but also as the evening treatment. Thank you very much for watching.